Hey guys, we are starting Unit 3 on Laboratory Tests and Procedures. In this unit, you will need to read Chapters 37, 38, and Chapters 40 to 43. I know that's a lot of content, but this unit is very broad. We're going to talk about lots of different things. So particularly look at what is in this PowerPoint and hone in on those areas in your text as you are studying. As always, your learning objectives are listed here for you to review. Okay, so let's talk about the laboratory. There are many different ways that lab tests are obtained and processed. So some of them you'll work in a clinic, some of those specimens you'll get in your clinic, and you'll perform them within the physician's office laboratory, or POL is what we call it. Some will be procured and packaged to transport and you'll actually send them off to another lab outside of your clinic. And then sometimes you will actually send the patient to a different facility for them to grab the specimen so they'll collect it and process it there. But whichever way that you are using a laboratory, it's important to focus on safety and also the accuracy of our results. There are many purposes for laboratory testing, so just some of them are listed here and you can read over those yourself. There are different types of laboratories. They're identified by different sizes, capabilities, and affiliations. You may have an independent laboratory. It can be located within a medical center, though, or a large clinic, but it's still independent. And they may have smaller satellite offices in different areas throughout a city or different county or whatever. And then you may have a hospital laboratory. For instance, I work at Methodist, Germantown, and they have their own hospital laboratory, right? There may be a reference laboratory. This is independent and regionally located that services larger areas. So we do have some send-off tests that sometimes have to be sent to a reference laboratory. Ours is located in Nashville, and they have those certain labs. Certain specimens have to be sent there to be processed and can't be processed in our hospital-based laboratory. And then lastly, the one that you may be the most used to, or the one that you actually will use once you become a medical assistant, is the physician's office laboratory. And this is physically set within the clinic. And a lot of these have self-contained kits for different things like pregnancy tests, strep swabs, fecal occult blood test, urinalysis. These are things that are pretty simple to process and can be done within your clinic. Let's talk about who works inside of a laboratory. First, you have a pathologist. This is going to be a medical doctor or PhD scientist. They direct and manage the lab. Everything that goes on inside of it, they're the ones that are in charge. They also interpret those biology results. They're the ones that interpret pap smears and other cytology samples. So they're the highest level in this laboratory. You then have one step below, which would be a clinical laboratory scientist. These individuals have bachelor's degrees often. Some of them may have master's in life sciences or medical technology, and they're certified by different agencies. They're qualified to perform analysis testing and work in different departments of the lab. They often have leadership roles, so they may have a team underneath them, and they can troubleshoot different problems with specimens or instruments used within the laboratory. Below them, you may have a clinical laboratory technician. Oftentimes they have associate's degrees or certificates from accredited programs, and they perform some of the more routine tests. But they may specialize in one certain area of the lab, which we'll talk about the departments here in just a second. And then you may also have a phlebotomist or phlebotomy technician that works within the laboratory. And these individuals are trained mainly through certifications, but sometimes on-the-job training to perform venipuncture and actually to get the blood samples from patients. And then sometimes you do also have a medical assistant working within the laboratory. Just depends. The most specific one would be a medical assistant working within a clinic and processing those samples within the physician office laboratory. So these are the different departments in the labs. We have hematology. This department looks at the quantitative and qualitative test of formed elements of the blood. So they look at different complete blood counts and differentials, coagulation and clotting factors, and things such as that. There's also a chemistry department. They look at the chemical composition. So hematology looks at formed elements of the blood, whereas chemistry looks at the chemical composition of blood. Also cerebral spinal fluid, that's what you'll see, that CSF, and joint fluid. So they look at those different electrolytes, different glucose levels and enzymes. So they're dealing with the chemistry of these specimens. You have a urinalysis department. They look at all of the ongoings with urine, physical, chemical, and microscopic. Then you have serology, immunology, and immunohematology, which evaluates the body's immune response and production of antibodies. You also have toxicology. So this is looking for different toxic substances within the blood and also monitors drug uses. So when we think about toxicology, we often think about what kind of illegal drugs may be in someone's system. But this department looks at different drug specimens that are prescribed. Some medications like lithium have to be given and held at a certain level within your bloodstream to be effective. So it's not just illegal drugs like cocaine and heroin and things like that they're looking for. Sometimes they're actually looking at prescribed drugs to make sure that they are having the right response. But yes, this is also the department that would be processing drug screenings for like employment reasons. There's the DNA department, paternity and maternity tests. It's kind of easy to think of, but also criminal cases if they're looking for DNA in different, let's say like a murder case or something like that. Microbiology. There are 3 different kinds of kind of breakdown here. Mycology, it's looking at fungi, and virology, which can be either viruses or bacteria there. And parasitology sometimes is kind of grouped in with micro. So parasitology is the study of parasites. So these are some of the departments that you may see within a lab. Quality controls and assurances in the lab. Just like vital signs, it is so important to reassure that we are getting the most accurate results as possible. And some things that we can do to ensure this is to follow these different safeguards and these different protocols and control tests and such. So there are safeguards that are put into place, testing equipment, making sure personnel are trained appropriately, all of those things, as well as performing control tests. We have to test our equipment to make sure that they are meeting standards and actually giving us an accurate result. Preventative maintenance, proficiency testing, and instrument validation. So many things that we can do to assure that we are having quality and accurate results. Okay, so CLIA. This is the Clinical Laboratory Improvement Amendment. CLIA was designed to set forth safety policies and procedures to protect people. So previously, in the past, laboratory tests were not regulated, which is kind of scary. And this actually resulted in some patient deaths. They had some pap smears that were misread, and it led to patient deaths because they were misread. So after that incident, it was the CLIA was the amendment that was put into place to regulate all lab tests performed on specimens taken from the human body. And all laboratories must meet these performance requirements, and they're based on how complex a test is, which we'll talk about in this next slide. So CLIA developed these 3 categories of testing. It's kind of a way to say which tests are the most complex, which one has the highest level of interpretation, and which ones are more easily interpreted and less likely to cause harm if misread. So these 3 categories, we have the first, which is a wave test. These tests are simple. They require a minimum of judgment and interpretation. The test error carries minimal hazard to the patient. So the MA may perform lab tests in the physician office laboratory, and these will all be wave tests. So some examples of wave tests may be a urine pregnancy test. This is a pretty simple interpretation, right? It's either going to be positive or negative. The person's not going to necessarily have a death if it's interpreted, correct? So if, let's say it was interpreted positive, but they were actually negative for pregnancy. It's not a great thing that it was misinterpreted. However, it will not result in a death to the patient. So other examples would be urinalysis, cholesterol, blood glucose, fecal occult blood tests. All of these can be done as a wave test in the physician office laboratory. Moderate complexity is our next level for the CLIA categories. This requires a higher degree of training, personnel licensing, and it has more strict regulations. This is a provider-performed tests, and they require a moderate complexity. Some of these would include like wet mount preparations. If they have to actually look at something through a microscope to interpret the results, this would be considered moderate complexity. And this will be performed, like I said, by the physician. And then higher complexity is the most complex test and has the highest level of qualification for personnel and regulations. So diagnosing someone with a type of cancer. This is going to be done by the pathologist inside the lab, not within the provider's office. This is, again, that highest level complexity. So we have waived, which can be done by medical assistants or other individuals within the physician office laboratory. Moderate complexity are often going to be those provider-performed moderate tests. And then higher complexity is going to be that highest level that has a pretty high need for qualified personnel and is going to be the most regulated. So let's quickly talk about lab requisition forms and reports. So anytime that we have a specimen, we're going to have a printed requisition form for the lab work to be sent to the laboratory with the specimen, or with the patient if the patient is going to the lab to have the specimen collected. These forms are pre-printed with the most common tests separated into different categories. And on the next slide, I have a picture of it. I'll show you in a second. The areas have to be completed. So the provider's name needs to be on there, their account number, their address, their phone number, in case there's any questions from the lab to reach out to the provider. The patient's information has to be there. The patient's billing information, because the lab may be the one billing them for the services provided by the lab. The source of the specimen. So is it a blood specimen? Is it urine? Is it feces? What is it? And then what test do they want to run on it? So maybe it's a blood specimen that you sent. Now what test do you want done on it? Do you want a potassium level? Do you want a complete blood count? What do you want? What does the provider want tested from the specimen that you sent with it? Or if you're sending the patient, what specimen do they need to get from the patient? And what test do they want run on it? Here's an example here. I will also have these in class for you to look over. But again, all of these categories must be filled out so that the lab knows what to process and who to bill and who the results need to be reported to. So I'm going to stop here so you guys can digest some of this information, and we'll pick back up talking about the specimens and how to get the best quality specimens for our specific lab tests.